James Thomas, Morning Blend. You know, there's been a few problems going on out there. We're talking about September is Menopause Awareness Month. And with me is Dr. Sheryl Kingsberg and Shirley Weir. Ladies, how are you?
We're great, thank you.
So, quick question, and I guess either one of you can answer this. Why don't women feel comfortable talking about menopause?
Women have been fed a long history of myths and misconceptions. There's a lot of negative energy that's been attached to menopause, and we believe that's prevented them from having conversations. But what I've found, and I talk with women about this topic all day, is that when you do crack open the conversation, women become empowered, they become more informed, and then they realize they're not alone, they deserve quality of life, and they can get easy, viable solutions. They're not meant to suffer in silence.
I think there are three reasons why women don't talk about menopause. Number one, they don't know what it is actually. They think it's a disease, and it's not. It is something that happens to every single woman. It is the loss of ovarian hormones that comes with age, which is the second reason they don't talk about it, because it's associated with aging, and we seem to think that aging is embarrassing or something we shouldn't talk about, but it's empowering. Women, as they move through life, get better, and so that's another reason. But another reason is they don't know that there are things that they can do to treat symptoms of menopause. Remember, it's not a disease. But up to 80% of women will experience hot flashes and night sweats, which are really uncomfortable and can really disrupt quality of life. And more than 70% will experience vaginal symptoms, urogenital symptoms like dryness and pain with sexual activity, and sometimes even incontinence or urinary tract infections, all of which can and should be treated, but often go undiscussed.
So what has changed in how physicians think about or help women to manage symptoms of menopause?
Well, over 17 years ago, the initial Women's Health Initiative study was published with some misleading interpretation of the data that now in 2019 has finally changed. So the North American Menopause Society has put out a position statement that reviewed all of the data from then and moving forward that really suggests that first-line treatment for women suffering from vasomotor symptoms, hot flashes, night sweats, or who are at risk for osteoporosis, which many women don't realize can be related to that loss of estrogen, really should consider hormone therapy, talking to their doctor within 10 years of menopause, or if they're an appropriate candidate. And they should, and we now know that we can treat with local treatments, which many are actually new and safe and effective, little doses of hormones that have virtually no systemic absorption that can manage those symptoms of vaginal dryness and pain with sexual activity.
Shirley, tell us about MenopauseChicks.com. I love that name. And tell us about tell us about your book.
So MenopauseChicks.com is an online community where women can get empowered and learn how to navigate perimenopause to menopause with more confidence and ease. I created the community because there wasn't one when I went looking online for resources. But the thing that's really changed is that there are valuable online resources for women where they can get informed. Today we're talking about findyourcool.com, which is a great place where women can start. Midlife health education is not something that women necessarily sign up for, but this is a great time to invest in their health, to pay attention to how they eat, move, sleep, manage stress, and get informed. Because the more informed we are, the more empowered we are, the more we realize that this really is a time to enjoy quality of life.
So, Dr. Kingsberg, why do some doctors not speak about menopause with women who are entering or in menopause?
Well, unfortunately, they don't recognize that it is a condition that women aren't talking about, and so they think, well, my patients, if they had symptoms, they would tell me. So there's this conspiracy of silence that women think, well, my healthcare provider will certainly ask me about something that they can manage and treat, and the healthcare provider thinks my patient would tell me if she was having symptoms. We tend to ignore menopause symptoms often, and as Shirley had pointed out, because the symptoms start before actual menopause, and so nobody's making that connection, or the symptoms start after menopause. So it's that one period of time called menopause, 12 months after your last menstrual period, that is marking the condition, but people are not recognizing that there are treatable symptoms and they need to be talking about it. If your healthcare provider is not talking about it because they're not getting trained, find somebody who is. North American Menopause Society can help you find that. Findyourcool.com can get you informed of what questions to be asking, because your practitioner should be asking. This is so important. We have 1/3 of our lives postmenopausally. We want that period of life to be exciting, healthy, and full of vitality.
Ladies, thank you so much for joining us on Morning Blend. Shirley, I think I'm going to start something called menopausedudes.com.
Yeah, for sure. For sure. I love it.
Thank you again, ladies.
Thanks,
you.
James.